Attention all healthcare providers. Here's a message from Health and Safety. As you know, SARS first hit Toronto February 23, 2003. As of now, there have been 4,300 cases worldwide. There's been a reduction of cases and deaths recently. However, the virus is still present and has a possibility of recirculating back into the city. This video will provide you with a brief overview of SARS and what you can do to prevent a second outbreak from occurring.
So, how does SARS work? Severe acute respiratory syndrome is caused by the SARS coronavirus. Coronavirus is a positive and single-stranded RNA. These viruses attack mainly the respiratory system, which may cause various symptoms such as coughing, headaches, chills, rigors, dizziness, and shortness of breath. SARS has three main stages. The first stage is when the symptoms are normal than any other viral infection, such as chlamydia. The second stage entails of the recurrence of fever, onset of diarrhea, and oxygen desaturation. Only 20% of the patient progress through the third phase, where they develop acute respiratory distress syndrome entailing ventilators.
SARS is an airborne disease but can be transmitted by coming in close contact with the infected patients or unsanitary places. When someone sneezes or coughs, the infected droplets become airborne. People are able to develop SARS if they breathe the air and touch the infected particles. Researchers have discovered that coronavirus may live on hands, tissues, and surface for 6 hours in these droplets, but only 3 hours after the droplets have vaporized. Moreover, the live virus has been found in feces of people with SARS and can live up to 4 days in it. As there is no treatment, the best way to combat SARS is by prevention. There are many measures you can take in order to keep safe during a SARS outbreak. Working in hospitals means you will be the front line in combating these issues. Isolating victims who show signs and symptoms is one of the tools which can make a large impact in prevention of further spread of the disease. This includes limiting or totally restricting visiting hours of family members and friends of patients. When coming into contact with the patients, it is vital that all protective gear is properly used by staff members. Proper protective gear includes facial masks, gloves, as well as a gown. These items must not be removed at any time while in contact with patients and should be properly disposed of after use. Additionally, continuous hand washing is also a way to ensure no bacteria is left after assisting patients.
Apart from knowing how to diagnose SARS, healthcare professionals should also know how it was transmitted from person to person. SARS was first reported in Asia and southern China. The virus was transmitted from horseshoe bats to mammals like civets that were found in marketplaces in China. Thus, workers and customers that came into close contact with these animals likely contracted the virus and spread it to the human population.
But then you must be wondering, how did this virus spread all the way to Toronto? Well, the answer is due to globalization. Globalization is a growing interconnectedness between humans all around the world. With growing technological developments that make traveling the world become temporally smaller and financially cheaper, institutes a greater movement of people and ideas. This can bring with it both positive and negative effects. Globalization is causing profound and unpredictable changes in the conditions that shape how infectious diseases affect the population. These changes have led to alterations in the prevalence, spread, geographic range, and control of many infectious diseases. Modern-day technology and transportations can spread an infectious disease from China to the other side of the earth and Canada within a day, as you witnessed with SARS. As a result of globalization, global governance should be implemented in order to improve systems for prevention, control, and treatment.
There are a few risk factors in regards to SARS, which include cities with high urban populations and you. As a healthcare provider, you are most at risk for contracting the disease. Transmission is largely confined to a healthcare setting in Canada due to contact with non-diagnosed cases. During the first outbreak throughout the city of Toronto, healthcare workers made up 43% of cases. With this being said, it's important to protect yourselves. Without you, there is no one to prevent further spread, and this second outbreak could have the possibility of expanding across the city, if not the country. Poorly understood infectious diseases such as SARS can incite widespread panic among the public population. In order to effectively convey the importance of taking precautions to the public and ensure they feel safe, here are a few approaches that may be helpful. Be truthful, honest, and open. Do not minimize or exaggerate the risk. If in doubt, lean toward sharing more information, not less. People may think something significant is being hidden or withheld. Last, communicate clearly and with compassion.
Finally, no country is completely safe against the invasion of an infectious disease. However, with your help and awareness, we can focus on keeping those most at risk safe, and most importantly, keeping the public both calm and informed. Remember, protect yourselves so you can stop the spread for good.